Welcome everyone to this new video. First, let me introduce myself. I am Dr. Dhyaneshwar Iyer Swami. The video is about recording of blood pressure. So, what is blood pressure? It is defined as the lateral pressure exerted by the column of blood on the walls of the arteries. The pressure is not constant, but it is pulsatile. Systolic pressure is the maximum pressure during systole. Diastolic pressure is the minimum pressure in the arteries during diastole. Pulse pressure. It is the difference between the systolic and diastolic blood pressure. It indicates stroke volume. Mean arterial pressure is the average of the arterial pressure measured millisecond by millisecond over a period of time. It is not equal to the average of systolic blood pressure and diastolic blood pressure. So, mean arterial pressure is equal to diastolic blood pressure plus 1 by third of pulse pressure. It helps in the forward movement of blood in the lumen of blood vessels. All the reflexes are sensitive to mean arterial pressure. Variation in blood pressure. Age, gender, meal, sleep, emotion and excitement, exercise, posture, temperature, pregnancy. Principle. The pressure of blood in brachial artery is balanced against the pressure in a rubber cuff and then it is measured by sphygmomanometer. Methods. Direct, indirect. In indirect, palpatory, auscultatory, oscillatory. Precautions. Subject should be mentally and physically relaxed. The arm should be relaxed. The cuff should be at the level of heart. The cuff should be neither too tight nor too loose. The tubes of the cuff should be directed downwards. The cuff pressure should be decreased to zero level. The size of the cuff should be proportionate to the circumference of the arm. BP apparatus. So right side is a figure of mercury sphygmomanometer. So parts of it: mercurial manometer, mercury well or reservoir, rubber bag with linen cuff, the rubber pump or balloon with valve, LCD sphygmomanometer, digital sphygmomanometer, cuff size. It should be ideal according to age and body size of a person. Length equal to 2/3 of mid-arm circumference. Width must be 1/3 of mid-arm circumference. Width of the cuff should be, in adults, 12.5 cm, in children up to 8 years, 8 cm, in children up to 4 years, 5 cm, newborn and infants, 2 to 3 cm. So, procedure: apply the armlet over the arm with the middle of the cuff, the bag over the inner side of the arm with its lower edge, 2 cm above the elbow. So, how to tie the cuff? Tie the cuff of the sphygmomanometer around the arm of the subject properly, neither tight nor loose, about 2.5 cm above the cubital fossa, in such a way that the midpoint of the rubber bag of the cuff overlies the brachial artery.
Please take care. Middle of the inflatable bag should be just above the brachial artery. The cuff should neither be too tight nor be too loose. This way we can tie the cuff.
Palpatory method. Palpate the radial pulse of the same hand. Inflate the bag in steps of 10 mm of mercury till the pulse at wrist disappears. Deflate the cuff very slowly and note the pressure at which the first pulsations appear over the radial artery. This pressure is indicative of systolic pressure. It is not possible to measure diastolic blood pressure by this method, but it is necessary to start with this method to get the rough idea of systolic blood pressure before proceeding to auscultatory method. Palpatory. Advantages: no stethoscope, no auscultation, not time consuming. Auscultatory gap is not missed. Disadvantages: record only systolic blood pressure. Auscultatory method. Apply the stethoscope lightly over the brachial artery located by palpation medial to biceps tendon. Inflate the cuff to few millimeter above the pressure observed by palpatory method. Deflate slowly and listen to the appearance of series of sounds known as correct cuff sound. So see the boxes in the right side. When the cuff is inflated so that it stops arterial blood flow, no sound can be heard through a stethoscope placed over the brachial artery distal to the cuff. Correct cuff sounds are created by pulsatile blood flow through the compressed artery. Blood flow is silent when the artery is no longer compressed. So, in the box on the left side, cuff pressure inflated above systolic pressure. No pulse sounds heard. Brachial artery occluded by cuff. No blood flow. Systolic pressure, the second box, the middle box. Systolic pressure. Pressure in the cuff is released to below systolic but higher than diastolic. Sounds first heard 120 mm Hg. Korokov sounds. Below that, blood spurts into constricted artery. Diastolic pressure. In the third box, pressure in the cuff below diastolic, below 80 mm mercury, sounds disappear, blood flows freely. Factors affecting blood pressure. So, blood pressure is equal to cardiac output into pulse rate. Cardiac output equal to stroke volume into heart rate. Factors affecting cardiac output: preload, afterload, myocardial contractility, heart rate. Factors affecting diameter of blood vessels, viscosity. Regulation of BP, short term baroreceptor reflex, chemoreceptor reflex, CNS ischemic reflex, atrial reflex, abdominal compression reflex. Intermediate, stress relaxation and reverse stress relaxation. Capillary fluid shift mechanism. Long term, direct, renal body fluid mechanism. Indirect, aldosterone system, renin-angiotensin system. JNC 7, classification of blood pressure. So, category, normotensive. Normotensive, systolic blood pressure less than 120 mm mercury and diastolic pressure less than 80 mm mercury. Pre-hypertensive, 120 to 139 mm mercury in systolic BP and 80 to 90 mm mercury in diastolic BP. Stage 1 hypertensive, systolic BP 140 to 159 mm mercury, diastolic BP 90 to 99 mm mercury. Stage 2 hypertensive, greater than 160 mm mercury, greater than 100 mm mercury in diastolic. Hypertension, sustained elevation of systemic arterial pressure, classified as essential and secondary. Now let us discuss some questions. What is silent or auscultatory gap? In severely hypertensive patients, after the appearance of sound, occasionally the sound disappear at a point below 200 mm mercury for a range of 20 to 50 mm of mercury and then reappear and finally disappear at the level of diastolic pressure. The period of first temporary disappearance of sound is called silent or auscultatory gap. It can be avoided by estimating the systolic blood pressure first by palpatory method. Changes in which pressure, systolic or diastolic, is more important clinically. Changes in diastolic pressure is more important clinically because systolic blood pressure is altered in many physiological conditions and it determines extent of work done by heart, while diastolic blood pressure remains within narrow range and it determines peripheral resistance. Next question, what is Korokov sound? When pressure in the cuff is progressively lowered, the sound undergoes a series of changes in their quality and intensity. These sounds are known as Korokov sounds. They are heard in 5 different phases. Thank you.